introduce Dr. Caroline Hwang. Don't be fooled by this. She is the medical director, not the associate medical director, of our Center for Inflammatory Bowel Disease here at USC. And she's going to talk to us about current medical management strategies. What do we do in 2017?
Thank you, Kyle, and thank you everyone for sticking around. It's always heartening to see a room full of surgeons so interested in IBD that they're willing to stay after 4 p.m. on a Friday afternoon. So I'll try to be brief. I have 15 minutes to talk about what's new in IBD medical management. And I really just wanted to sort of introduce, we do have some new sort of tools in our toolbox, so you might be surprised that some of your patients are on drugs that you may not recognize, so hopefully we can cover those very briefly today. So these are my disclosures. So as we all know, inflammatory bowel disease is a chronic gastrointestinal disorder. The Venn diagram talking about the cause of IBD has not changed over time, so we know that there's a genetic component comprising about 20 to 30% of the cause in Crohn's disease and between 6 to 18% in ulcerative colitis. And the genetic component interplays with some type of environmental trigger, whether or not it be antibiotics or an infection, and that causes a dysregulated mucosal immune system and the microbiome is a trigger for that overactive immune system. We actually know in mouse models of IBD, for instance, those mice will not get IBD in germ-free facilities. So the microbiome, as we all know, is very important in IBD, and that's being sort of more and more characterized. The prevalence is historically been 1 in 200, the greatest prevalence being in North America and Western Europe. But as you can see from this map, the first map on top being from the 1960s and 1970s, indicating prevalence around the world of IBD, and the bottom map showing a more recent map, a heat map, so to speak, of IBD from the 1980s to the present day. And you can see that more and more areas of the world are being colored in and they're becoming darker. So the prevalence is increasing all around the world. And it's striking, actually, in countries that are becoming so-called industrialized, so China, Brazil, people who are adopting more Western lifestyles are seeing a very rapid increase in IBD. And actually, fascinatingly enough, we at USC, being at LA County, also see a really rapid rise in immigrants from countries where there's not a lot of IBD. When they move to this country after a decade or so, their incidence of IBD increases. So it's a very interesting phenomenon that we're seeing in terms of prevalence, and sort of highlights the importance of the environment for the trigger in IBD. So as we all know, there's 2 subtypes of IBD. There's ulcerative colitis, which affects the colon only.